Welcome back to the Now Morning Show. So this morning, we're tackling the rise in canine respiratory cases with Dr. Paul Crooks, a leading authority from the Trinidad and Tobago Veterinary Association and founder of the Tobago Animal Hospital. So let's sit back and discuss the recent spike, data misinterpretation, and the dangers of misinformation on this issue. Good morning, Dr. Crooks, and welcome back to the show.
Good morning. Thank you for having me, and Happy New Year to you and the viewers as well.
It's a pleasure to have you, and Happy New Year from all of us here on Now. Hoping that the new year is treating you well so far. And of course, already off to a busy start as we get straight into this conversation about this spike in cases. Now, if I'm not mistaken, it didn't start here. It started in the US. Is that correct?
Yes, that's correct. There was a report or several reports that built on initial reports that spoke to an increase in veterinary visits for respiratory cases or cases related to the respiratory system.
So what caused this spike, and why would you say the concerns were overblown?
Right. So basically, what we've seen in the United States, and there was a panel discussion, I want to say in middle December, about this particular, what appeared to be initially an epidemic, an increase in the number of cases above the normal baseline. What we had was an insurance company, or maybe even several insurance companies, remarking that in certain parts of the United States and Canada, there were increased insurance claims for respiratory cases in canine animals. So we're looking at insurance companies saying more respiratory cases occurring above the baseline, what they established to be the baseline in these certain areas. However, when we took a broader view of the way that the cases were divided among the states, it did not appear to be statistically significant. So while, yes, there were increased cases, there are a few explanations that we think would fit with the increased cases that we saw. For one, we've seen a decrease in vaccination uptake. In Trinidad and Tobago, there may be a disease called kennel cough. It's not very common, and also it's not very often that we vaccinate for it. However, in the United States, kennel cough is a fairly common bacterial disease that causes a severe cough. Most animals survive. However, because we've seen a vaccine hesitancy, so it's not just in human medicine, we've been seeing increased vaccine hesitancy in veterinary cases as well. And because we've seen that, now that we have waning antibodies for cases that should have been vaccinated annually or so, or we're seeing that there are puppies that are born and now growing up without vaccines, all these animals are susceptible to diseases where previously we had a fairly good barrier of protection, a good level of immunity, so we had a certain expected number of cases as a result. So in 2023, very late 2023, it seems that many of the cases are related to diseases that are vaccine preventable. That's one thing. However, even going beyond that, we have to look at the analysis and potentially misinterpretation of data. Now, as human beings, we're biased. If you hear that there is a 1 in a million chance for, let's say, a vaccine negative reaction, 1 in a million is extremely rare. You can say with almost certainty that everybody you've ever met will not experience a negative effect. However, 1 in a million is still a chance. Versus if you have a 10% chance of getting a disease that proves fatal, if you are one of that 1 in a million group who experiences a negative reaction to a vaccine, even though you may know it's 1 in a million persons who experience that, you may not be able to divorce yourself from your own personal lived experience to say that I am 1 in a million and therefore I will continue to receive vaccines, I will continue to promote vaccination, you, having lived the experience, will think this is a real major risk for me. With the data set in the United States as it came out, even medical professionals tend to have that bias where you see something occurring, and especially, I want to say, especially medical professionals, especially young medical professionals, you see something happening and you want to think it's a new, exciting case. You don't necessarily want to think there may be other factors explaining why we're seeing this possible increased number of cases. And
Now,
so,
and Dr.
go ahead.
Crooks, not to cut you, but one of the things that we're really getting from this is that we're seeing, of course, the human experience crossing over into that of pets and how it can influence their lives, their lifespan as well. So what would you recommend individuals do to perhaps move away from this and ensure that our pets are not just vaccinated, but have that full life that they need?
Well, this is what I was getting to. So importantly, you need to have a trusted veterinary-client relationship. Again, even vets can make mistakes, can be misguided, can receive data and misinterpret that data. That can happen. Even medical professionals can. But I want to advise vets and everyone that when you are in a medical crisis or where there's the possibility of a new disease, because information is constantly being updated, you have to stay current. So again, if a vaccine produces a negative response 1 in a million cases, and those 1 in a million cases are documented, that does not get away from the 999,999 cases where it works and works well. So as things continue to evolve, pay attention to the larger and larger data sets, pay attention to the information from the experts, the large bodies of experts, because this is how you monitor a progressing disease, potentially a progressing disease. And so with a trusted veterinary-client relationship, please consult your veterinarian. Don't just read a headline or read what you saw in a YouTube video or wherever you get the information, something that was shared on WhatsApp. Don't just read that and assume it to be true. Even if it is true now, in 10 days it might change, in 2 weeks it might change.
The dangers of misinformation and, of course, the necessity of being fact-checked, which is something that we need to be checked on this morning on the Now Morning Show, because one of the things that we were discussing is the Sahara Dust in Trinidad and whether or not it can affect our animals. Could this be a contributing factor to any sort of dis-ease in animals and their respiratory systems?
That's an excellent question. And yes, it really can. Basically, anything you think that would affect a human would also affect an animal, and in very similar ways. It may not be every animal, it may not be as common in dogs or cats, but yes, indeed, Sahara dust can cause respiratory disease, can cause allergic signs in animals, can cause coughing and sneezing. So absolutely, Sahara dust plays a role. And again, if you're just looking at respiratory signs, this time of year, where the temperature has decreased, even though we never get very low, we still can get down to 19 degrees Celsius in the night in January. And where the temperature has decreased, people here in Trinidad and Tobago, where we are accustomed to higher tropical temperatures, we are more susceptible ourselves. And there are, of course, circulating canine flu viruses and so on that make, if the dogs are more susceptible, they also may get sick.
And devastating to think about poor animals being, subject to these flus going around as well. At least, as humans, we can pop off to the pharmacy and get something, go to the doctor and so much more. But definitely we are their keeper. Dr. Crooks, do you have any closing comments before we end our conversation for today? Because we know you'll be back.
Well, again, thank you for having me. And for more information, call the Tobago Animal Hospital at 239-7837. And for those who want to contact the Trinidad and Tobago Vet Association, you can email us at ttva2008@gmail.com.
Wonderful. Thank you so much, Dr. Crooks. All the best for 2024 and see you soon.
Thank you very much.
Of course, a conversation there talking about respiratory issues happening in animals, not just here, but throughout the world. Stay tuned. Teachers' back pay is the next point of conversation on Now.
All